Maybe this is the charm. You're looking at Steve Scalise, one of the Republican leaders here, trying to get this process going here. Both sides are sort of talking things up, greasing the skids for the vote that is expected to pass an effort to repeal, ultimately replace the Affordable Care Act. The Republican Study Committee Chairman, Congressman Mark Walker. Now, he's voting for this health care overhaul here, but is there any chance, Congressman, very good to have you, that this could be pulled at the last second if some votes that they expect will be there don't materialize? Do you know what the plan is?
Yes, I don't believe there is any consideration for pulling the vote at this time. It is going to be a close vote, we believe. But even if it goes one way or the other, we'll be voting on this today. It's what the President has asked. It's what Speaker Ryan has asked. And I believe it's time for the American people to see their members of Congress either put up or shut up regarding the repeal of the ACA.
All right. Do you worry that the way the President framed it, that you got to do this now because it's not perfect, but it's better than the law it's replacing? That's kind of the pitch that he's made, Congressman. Is that your view?
No. In 30 months that I've been here, Neil, I don't know how many times I can recall a perfect piece of legislation. However, it's important to understand that this particular, the AHCH, reforms Medicaid for the first time. And I don't mean to give just the talking points, but to be able to lift the mandates off both employers and individuals, that's a huge thing, plus repealing $1 trillion of these Obamacare taxes.
All right, so when you do remove a lot of the taxes and all that, but some worry that you leave the health care law itself in some disarray, replacing it with a program that might not be as well funded, and that's the benefit of not having a CBO score to this, because the CBO might not score it so friendly. What do you think?
Well, I think the bulk of this legislation was scored a few weeks ago. Hard to put a percentage on it, whether you say 80 or 90%.
Yeah.
A few amendments or tweaks haven't been scored, but I don't think it's going to relatively change from what we saw earlier.
Well, we do know that the provision that Fred Upton, Billy Long of Michigan and Missouri, respectively, Congressman, added another $8 billion to the cost of this over, I think, 5 years. But is it your concern that a lot of add-ons and a lot of ways to get this through have made this much costlier than was originally going to be the case?
Has it been a little costly? It has. But remember, it is not the people with either pre-existing conditions or in the individual market whose fault that they have the ACA. That is Congress, even though Republicans didn't vote for it. So to yank the rug out of those in the individual market certainly wasn't something that Republicans desired to do. And that's why I think we have a huge majority that will be voting yes on the AHCA.
All right, let's talk a little bit about what happens after it leaves the House, assuming it wins in the House, and you're closer to this than I'll ever be. The Republicans have already expressed concern that there have got to be tighter provisions to sort of limit the number of people who potentially could lose their health insurance. Some of the numbers Democrats have bandied about, Congressman, is up to 24 million who could lose coverage. Is it that high?
No, it's a false number. Remember that 24 million includes people that have a choice not to pursue insurance. If you're mid-20s, maybe you want to put that money somewhere else. What this does, it reduces or removes completely a government-mandated tax on those who wanted to manage their health care in their own manners. That's what Republicans believe when it comes to the limited government.
So assuming this gets passed out, assuming, after maybe weeks, months of wrangling, a version gets cooked up in the Senate, back to conference, when do you see this all getting done?
I think sooner than later. The few senators that I have, even those from North Carolina that I serve alongside of, they want to move quickly on this. I know that's the President's desire. And remember this in closing, Neil. We hear a lot of times, why can't you just fix the ACA? The original 2,600 pages, another 6,000 pages have been added to that. Even former President Bill Clinton said not too long ago, this model simply doesn't work here. It's our job to put together a health plan that gives the individuals more options and more choices.
So the fall, you think?
I think sooner than that.
Okay. We'll watch closely. Congressman, thank you.
Thanks, Neil.